Welcome back. Thank you for joining us again at Tech Week TV here in the middle of Tech Week. It's been a great afternoon, actually. Lots of great conversations. I hope that wherever you are and whatever you're doing, you are enjoying the content and the intellectual stimulation that we've been having this afternoon. We've got another good session. We've got two more this afternoon. At the end of the day, we'll finish by talking about agri-tech. But first up, we're going to talk more about digital health. We touched a little bit earlier about health technology. That was more in the deep tech health space, but we want to talk about digital health. And it's a really interesting topic for us because clearly health is really near and dear to everyone's hearts. And the technology underpinning our health system frequently falls into that kind of out of sight, out of mind, we don't know what's going on sort of category, particularly for patients. It's just sort of something in the background. But for AUT Senior Lecturer Sam Madanian, who we're going to talk to in a moment, digital health is a passion that she's devoted a lot of her research to. And in this session, we're going to be inspired to, find out what inspired her actually to pursue digital health, what opportunities we see in the sector, and learn more about recent research. We actually got two amazing guests. We've got Sam Madanian, the senior lecturer here from AUT, and I'm just going to read your whole bio here, not the whole thing, because the whole half hour would be up then. But Sam is a senior lecturer and postgraduate program advisor for the Masters of IT and Project Management at the Department of Computer Science and Software Engineering, a digital health expert, a fellow of the Australasian Institute of Digital Health, which is amazing. Also part of the IoT Alliance. We'll talk about the link between IoT, so Internet of Things, and health. I'm sure we'll talk about that. A multidisciplinary background, project management, business analysis, solution architecture. It goes on and on. It's wonderful. One of the things I love the most about your CV is that you supervised nearly 30 master's research students in computer science and information systems and project management and analytics. So you are really paying it forward to the future generation as well as being a researcher yourself. Welcome, Sam.
Thank you.
And with Sam, we have Dr. Andrew Lowe. Andrew is currently the Professor of Mechanical Engineering and Director of the Institute of Biomedical Technologies at Auckland University of Technology, AUT. Currently researching things like modelling of the cardiovascular system, community care, advanced measurement of electrical systems generated by our human body. Apparently we generate electrical things. We're going to find out presumably about that. And Andrew, similarly, many qualifications and recognition, including taking products through idea to manufacturing. We talked about that earlier. With Aroa and Allometry, the FDA approval process, which you've done as well. And before that, you led the software development for robotics. You have a PhD from Auckland University with a thesis in fuzzy logic, which is not just making stuff up as you go along. It actually is a discipline. And we are, so much to go on. I'm going to skip now because there's so many degrees. You've got about 3 degrees. Welcome to both of you, to Andrew and Sam. Really appreciate you being here at Tech Week TV.
Thank you.
Thanks.
Should you correct me on anything I just said there? I mean, basically what I tried to say is you're very well qualified to talk about digital health from many different perspectives. What do you think in New Zealand at the moment the current state of affairs is of digital health?
Well, that's a tough question, let's say, because digital health is started all around the world. It's not New Zealand specific.
Yeah.
Because before all the technology enhancement, all the recent revolution, and also the most important one is COVID. We always rely on our traditional way of referring to the healthcare system, using healthcare services, but now everything specifically most recently and after COVID, during COVID, it's revolutionized.
Yeah.
And we realize how technology can help us to facilitate healthcare services, to provide more equitable access to healthcare services, especially for countries with low resource or even communities in remote areas.
Yes. So, I mean, as you say, COVID has shifted, I suppose, many people's perceptions. I'm sure those of you who worked in the sector and have researched in the sector, there were things that didn't surprise you. But for the average citizen, we suddenly realised how important the health system was. Andrew, did you see some big shifts and changes in your world because of the COVID
Yeah, I think there's been a lot more acceptance now of things like telemedicine because we had to, and we've started to get familiar with some of those technologies. And so now many patients and in fact many practices will default to a telemedicine approach if that's appropriate. So I think there's much more acceptance now. There's obviously a long way to go as well.
What do you think the opportunities are for digital health now that we've learnt a little bit more and technology's shifted and changed and grown? What are our opportunities for improving health outcomes?
So I think one of the things is being able to integrate a lot of information from all over the world, as Sam mentioned before, and apply it to specific people, so individualized or personalized health. Now we have to be careful about how that is happening, but certainly that is an opportunity that is enabled by digital health, really, because we can capture all that information, process it with some of these new algorithms, and try and apply that.
So it's sort of the match between like big data sets, massive amounts of information can get processed quickly in the cloud, but individualized, as you say, targeted information to an individual patient.
Right, and that opens up many possibilities, including with equity of people who might be in a rural community or perhaps less accessible healthcare becomes more accessible.
What got you, Sam? What got you into digital health as a discipline?
Well, what really motivates me to start this journey was when we look at healthcare sector as an industry or as a sector, and we compare it with other industry, we see that the technology utilization is not that advanced. For one good reason, I don't blame, because healthcare dealing with patients' life, it's a matter of death and life. So everything, all the technology and the revolution in the sector should be carefully monitored and planned before any sort of implementation. But when I compare healthcare with something like retail sector, which I was previously working on, or something like banking industry, you realize that there is a huge opportunity that you can provide by using technology. Generally, healthcare is under a lot of pressure, and it's a global issue. It's not country specific. At the same time, we are expecting more aging population who might constantly need health monitoring, different types of services, the issues of chronic disease, and the recent sort of increase in pandemics and epidemics. All of them just add more pressure to the healthcare. And when we look at the healthcare and all the increased demand, on the other hand, we have a shortage of skilled worker in the sector, doctors, nurses, other allied health groups, and so on. So this is where I've got motivated, or let's say just started to see how technology can really help healthcare. Just to facilitate, there is no sort of area for replacing people with something like an AI algorithm, but it's just come up with some more support to facilitate their work.
I'm glad you got into the sector and you sort of talk about the pace of change that happens in other sectors like the retail industry versus healthcare. And healthcare is in part still a bit archaic, It wasn't that long ago we were still taking pieces of paper as scripts to the pharmacy and it is still very manual and the process around it. And people are surprised sometimes about sharing of health information and how maybe it doesn't between doctors, etc. Do you think we could move more quickly on some of these things, Andrew? Do you think there's opportunity for us to, to make some real breakthroughs?
Yeah, that's an interesting question, because I think at a technical level, there's definitely opportunities to make breakthroughs or to make things a lot easier in terms of sharing information. I think one of the things, or some of the things that perhaps work against that are things like the slow standardization of technology, but also social factors and also economic factors. We live in a society where companies have to make money to be sustainable, and therefore data is actually a scarce resource or a valuable resource, and that becomes harder to find models to share that well.
Yeah. New Zealand has got a single health number or health kind of identification system, which, as I understand, is actually a fairly unique or valuable thing for us to have as a country. It's the basis for potential growth, isn't it? Yeah. Is it something that we probably don't understand or haven't really got the value out of yet? Having that single health number?
Well, in terms of this national health identification, it's something that brings a lot of advantage. For example, compared to other countries, when we do this sort of comparison, we realize that something on a national level can bring more opportunities for the public health and managing the whole healthcare sector from a national level. Otherwise, like some other countries, what we say, we ended up with the silos of data.
Yep.
And then sometimes there are conflicting data, sharing the data with insurer, with different doctors or different authorities. It's problematic. But luckily in New Zealand, we don't have such problems. It is one identifiable information for each person, and it's unique all through the life.
Right, good.
So information retrieval and everything is quite easy.
Yeah, so it's good that I've memorised mine then, just in case I ever need it. That's good. Have it tattooed on the inside of my arm. And you've done a lot of research recently, recent research you've done in terms of looking at the development and implementation of things like clinical information systems in developing countries, so countries that perhaps don't have the infrastructure. What have you learnt from that? And what, I suppose, have you been able to translate from more mature countries like New Zealand into those developing nations?
Well, probably I should say that instead of developing countries, something like low resource setting,
right?
To be more inclusive, more inclusive, because this is something that here in New Zealand and Australia, that I closely work in the health sector. We really see the challenge of providing health services for the rural communities.
Right.
One of the biggest challenge of low resource setting or remote areas is connection. Yes, they have the connection, but a decent connection most of the time is required to be able to connect with the areas. Yep. Then it's about the awareness, how to come up with all the public health awareness, how to use these services. These are some things that come up with additional or impose additional challenges for the healthcare.
Yeah.
Sometimes I think that in big cities we take it for granted that, we can dial in, we can Zoom with our GPs or doctors, but this is not the case in rural communities. Sometimes they don't have internet connection, or if we consider the event that happened, the flood that happened, the whole community isolated from getting any health services.
Yeah, they had to be very self-sufficient. So you're right, low resource setting, like you mentioned, is a better way to say, actually, just there are parts of any country that needs more help at times. Yeah, it's an interesting problem, I suppose, a set of problems to try and get into, and they're not always solvable. Which I'm going to go to your fuzzy logic. Is fuzzy logic a thing? This making decisions with inexact information, is that a factor behind the health system in general?
Definitely. I think most of our models of diagnosis, for example, in health are often quite empirical, so we're based on data. Fuzzy logic is interesting. One of the reasons for using fuzzy logic is actually that it's somewhat explainable in some forms, and that becomes really important for health decisions, because actually having a black box that tells you what to do or gives advice to a doctor is not nearly as acceptable as something that can explain its reasoning. And that's something that I think we have to grapple with. To what extent do we trust the black box?
Yeah, and patients have to trust. The black box is the entire system sometimes. It's the doctor himself or herself and the decisions they're making. And so in many ways it's just sort of another layer of beyond that.
Yes.
Which gets to the dogged question, and we've made it now 15 minutes into the interview, or 20 nearly, haven't talked about AI. And surely there's a big role for AI in the health system, but what is it? And should we be scared about it? and I know you've probably both been thinking about it or looking at it. What advice have you got? Should we be scared about AI in health?
Would you like to go?
I think like any technology, there's a huge opportunity for doing good with AI.
Yeah.
There's also a huge opportunity for making mistakes with AI. And so that's something that researchers and society at large needs to grapple with.
Yeah.
But certainly AI, I think there are different levels of AI, as you're aware. So some of the AI that we are working with is an algorithm that basically takes an input, spits out an output, and that relationship is a bit hard to explain, but it's pretty consistent.
Yeah.
That level of AI, I think we know the limitations and how to use it. Some of the newer aspects of AI, like ChatGPT, they're essentially a language model. So they take input as language and spit out language, and they do a really human-like job of doing that, as we all know.
Yep.
When we start to marry those things together and have an AI that does multiple things, then it becomes, I think, much more difficult to understand how we should interact with these systems.
Yeah, ChatGPT is wonderful and to use and not just play with, but actually use. But at the same time, it's like my wife says, it's like me at a pub quiz. I'm always very confident. I always think I know the answer completely, but I'm very often wrong.
Yeah. Very confident liar.
Yeah, exactly. Yeah. Often wrong, but never in doubt. And that feels like that's part of the challenge with AI, is that it looks like a computer and it makes computery noises and out spots a thing, and therefore you believe it. But that's not always the case. And I think you've been doing some research in this area, haven't you?
Yep. As Andrew mentioned, there are both aspects of using AI, but based on my research and my passion, I focus on the advantages of using AI and look at all the opportunities that it can create rather than not using AI.
Yeah.
Because many years ago, when internet is introduced, now we can't really live without internet or Google search engine.
Yeah.
Probably something similar happened. But in terms of its usage in healthcare, this is something that, again, we need to be extremely careful of using the AI model. There are some bias, there is no doubt, because all these models train based on what we give them. Or based on the provided information. But at the same time, when I look at how this information can help physician, and it's not about making any decision on behalf of the physician. It's just give them more support. That's what I call in using AI in my work is I call them a decision support system.
Yeah.
It just the AI is great in finding trends, patterns. So these trends and patterns can help sometimes in special cases, doctors or other allied health to identify one tiny sort of things that we might miss as a human.
Yeah. Particularly useful in things like image analysis, isn't it? Where large amounts of data or pattern recognition type tasks. That's some of the best business cases I've seen is where AI can sort images down to a subset that maybe a human needs to look at rather than having to look at thousands and thousands. And I think that makes a lot of sense.
Right.
And it is also implemented, the same application implemented for breast cancer.
Yes.
For the prediction or even just identify the tiny cells that we as a human, we cannot
might not
really
notice.
see.
Yeah. And safeguards, what do you think about the idea of introducing safeguards into the use of technology? Have we got enough of that thinking that's coming to the fore?
I'm more thinking that technology, and especially this AI, probably we need to think about how to raise the awareness.
Right.
How to not just promote all the advantages and potential, but also give people some information regarding the down aspects of or the tricky part of the technology. This is something that I believe we need to do it better.
Agree. Are you optimistic, Andrew, about the future of digital health? Are we on the right track? Are we doing things fast enough?
I think we are. Well, I think we're on a good track.
Yeah.
We're definitely making impact that's positive in people's health using these technologies. We need to be careful that we don't leave people behind, and we need to be careful that we don't overstep what the technology is capable of.
Yeah.
But yes.
We're on the right track. Sam, what do you think? Are you optimistic about the future for digital health technologies?
Yes, that's why this is my passion.
That's right.
Because I believe. When we look at all the global challenges, all the issues around the sustainability, lack of resources, and so on, it would be a great potential. It has a great potential to use technology for healthcare purposes.
Perfect.
But if it's implemented wisely and we know all the consequences.
Very good. And we put enough of our collective energy, weight, money, government policy behind it, we could be a country that really embraces digital health technology.
Yes.
Wonderful. Thank you very much both for your time.
Thank you.
Really appreciate you both coming in on late on in the afternoon, and thank you out there for watching another amazing section here in Tech Week TV. It's coming up to near the end. It's about nearly 4:20. We've got one more session this afternoon. It's talking about agri-tech. We're going to tell a few stories about New Zealand's probably our longest technology industry is agriculture. I mean, for 1,000 years we have been an agricultural nation, and we're going to talk a little bit about that and some of the stories that come from it. So please don't go too far away. We've got a few ads and things to play for you. We'll be back in about 10 minutes. See you then.